As medical inflation continues to rise at double-digit rates, it becomes critical when illicit activity drains funds from the system. Unfortunately, according to FBI estimates, health insurance fraud and abuse account for up to 10% of industry losses that are ultimately passed on to patients. With annual healthcare costs estimated at close to $2 trillion, that means as much as $200 billion can be lost to dishonest practices each year. One company is working to change this.
Here at the Sentinel Group, we see fraud being perpetrated by doctors, by hospitals, their employees, patients, billing agencies, you name it. People think it's a victimless crime, but it's part of the healthcare coverage that businesses and ultimately people pay for.
The results of one physician survey published by the Journal of the American Medical Association showed 39% of physicians have manipulated insurance rules to gain undue payment. Healthcare insurance fraud involves intentional misrepresentation of what services have been provided for the purpose of financial gain. The most common is billing for work not done. Abuse is when the medical services provided are inconsistent with accepted practices, resulting in unnecessary costs. That is, services go beyond what was truly needed, with the intention of inflating the total amount billed. A common example is the ear, nose, and throat doctor who sends every patient for a chest x-ray regardless of symptoms.
The Sentinel Group began years ago as part of Trustmark's effort to ensure that all legitimate claims were paid fairly and accurately. The more we looked at claims, however, the more abuse and fraud we uncovered. Today, the problem is not going away.
The Sentinel Group has amassed a formidable database of both usual and questionable billing practices and uses this data to spot fraudulent and abusive schemes. When specific billing activities diverge significantly from normal patterns, a closer scrutiny of the medical claim involved is initiated.
Our IBM fraud and abuse management system alerted us to a chiropractor who was billing exclusively for procedures on the same 2 regions of the spine on every single patient and was billing them at the highest service level fee that's possible. We had a board-certified chiropractic consultant review the claims and in fact certified that the claims were services not rendered and or billed at the highest service level fee that there was. We reported this particular physician to the state licensing board and to other authorities and saved approximately 90% of the bills.
The Sentinel Group fields a diverse team of fraud investigators with both clinical and criminal justice backgrounds. They're supported by sophisticated software and years of in-depth intelligence gathered from healthcare providers across the country, as well as consultants from every field of medicine.
We have another physician who was billing for multiple nasal surgeries on one patient. In fact, he billed for 6 separate procedures on that patient on that same date of service. We requested operative report and medical records and verified at the time that only 2 of those procedures were actually performed. We recommended an appropriate payment reduction and the claim was paid. Upon appeal from the provider, he submitted another operative report for that same date of service for that patient, and that particular one indicated that this was a cosmetic procedure. Thus, the intent to defraud.
As a result of these techniques, the Sentinel Group has saved its clients millions of dollars.
In the past 3 years alone, Trustmark's customers have recognized over $25 million in savings as a result of the efforts of the Sentinel Group. Guarding against healthcare fraud and abuse is an important business practice. It's a problem we must all take seriously.
The people of the Sentinel Group are on a mission to minimize healthcare insurance fraud and abuse.
The vast majority of medical claims submitted are not fraudulent or abusive, but as more complex and more creative schemes are developed, the more advanced the solutions will need to be.
To learn more about this story, visit the Sentinel Group at www.sentinelgrouponline.com.